Hello, I am Rohini Peris, President and CEO of the Environmental Health Association of Quebec. This presentation is titled Inclusion of Multiple Chemical Sensitivity in the Workplace. Multiple Chemical Sensitivity, MCS, is a recognized disability by the Canadian Human Rights Commission. It is a chronic medical condition whereby sensitization to chemicals develops from repeated exposures or a one-time exposure to high levels of chemicals, resulting in provocation of symptoms in multiple body systems. Sensitization and symptoms can be triggered by exposures to fragrances and to commonly used products such as those used for personal care, cleaning and laundry products, deodorizers, as well as chemicals emitted from printers, carpets, building materials, and furnishings. Exposure to these chemicals results in symptoms which include brain fog, breathing difficulties, pain, fatigue, cardiac, urinary, musculoskeletal, and gastrointestinal effects. People with MCS also have significantly higher incidence of comorbid chronic medical conditions compared to the general population. Over 16 years, from 2000 to 2016, Canada's population has increased by 14%. During this time period, according to the Canadian Community Health Survey, diagnosed cases of MCS have increased by more than 100%, and the prevalence has increased since 2016. Of the 1,130,800 diagnosed in 2020, 72% are women and 49% are over the age of 55. This disability encompasses the full spectrum of all disabilities and touches all ages, genders, communities, and other vulnerable populations. Finding accessible workplaces and retaining employment are key to maintaining the high costs of managing MCS. Without this, people spiral into poverty, isolation, and homelessness. To retain employment, people experiencing this disability depend on effective policies for fragrance-free and least toxic environments, which in turn depend on product choices for all applications, including building and maintenance materials, cleaning and personal care products, and clear information provided on acceptable product choices. The process of implementing a policy must include everyone, and especially people with lived experience. Continued education, awareness, and inclusion are key for ensuring accessibility. Designing, implementing, and monitoring good policies are important. In order to gain maximum cooperation, it is necessary to inform stakeholders, to address concerns, and provide new and adequate information to keep everybody updated of any changes. Information on acceptable product choices is key to ensure the goal, which is to have accessible indoor air for everyone. Policies can be reinforced through tools such as messages on phones, employment postings informing about fragrance-free policies in establishments, informing visitors in advance of appointments, visible signage in front of offices stating that the establishment is fragrance-free, a website that explains what it means to be fragrance-free and how to choose least toxic, fragrance or perfume-free products. Monitor success of policies through surveys and polls to measure success and improve on shortfalls, to ensure safety in reporting, to have a plan in place for monitoring and evaluating the level of compliance, reporting the results to stakeholders, and most of all, to ensure the ability of people experiencing MCS to be employed and to retain employment. An important resource from the Canadian Centre for Occupational Health and Safety will help to establish a policy in the workplace. The Eco-Living Guide can help with product selection, and the policy from the Canadian Human Rights Commission provides guidelines on accommodations for accessibility for this disability. These references cover policies and prevalence for the disability of MCS. Thank you very much for listening to this presentation, and don't hesitate to contact us for any further information. Thank you.